Our next speaker is Dr. Tony Singh and the color commentator, Robert Edelman. Dr. Singh is an environmental engineer and public health professional. He has over 18 years of work experience in the environmental engineering field. Since May 2019, he has served as Deputy Director for the Virginia Department of Health's Office of Drinking Water. Tony is a licensed professional engineer in Virginia and Washington, a board-certified environmental engineer, and a certified safety professional. He holds a PhD in chemical and environmental engineering, a master's in environmental science and engineering, as well as a master's of public health from the University of Virginia. He is coordinating the Commonwealth's efforts pertaining to the recent PFAS and lead legislations, and is here today to give an update on what we thus far know about PFAS and drinking water supplies in Virginia. Welcome, Dr. Singh.
Thank you. Good afternoon, everyone. And I have Bob Edelman with me. He's our Director of Technical Services at Office of Drinking Water. So we have a team who is working on this topic at Office of Drinking Water. We have heard some really nice presentations. Dr. Carey mentioned what is out there in near future. Dr. Cohen mentioned that the areas where we still need to work, and we are here to present you where we are, what we are doing as we speak, and how we are interacting with our stakeholders, how you can get involved, and where things stand as of today, right? So, who we are? We are Office of Drinking Water. We are located within Virginia Department of Health, and we regulate public drinking water supplies in the Commonwealth. We have over 2,800 regulants, essentially public water systems, who supplies drinking water to more than 7 million Virginians. And here is our mission, to protect public health by providing clean, safe, affordable drinking water. And as I mentioned, we have a team of more than 125 people who are working on this job. And this team doesn't count the numerous or hundreds of staff members who are working at our public water systems, our utilities. Next, please. I always give some advertisement for my office before any presentation, so I know you can't read, but all this slide says is that within Office of Drinking Water, we have multiple divisions. We have 6 field offices. We have some central divisions where that works on providing loans, grants, and looking at capacity development, operator certification, compliance enforcement, and things of that nature. Next slide, please. Yeah. So this slide shows that Office of Drinking Water regulate these more than 2,800 water systems via 6 regional geographic locations or field offices. So you can find your closest office from this map. So they are Culpeper, Richmond, Virginia Beach, Danville, Abingdon, and Lexington. Next, please. So that was all about drinking water, but again, if you want to know more about what we do, how we do, where you can reach out to, or who you can reach out to, you can catch me after this presentation. On this world of PFAS, I'm sure like everyone must have heard of this in one or the other conference, meeting, discussion with colleague, webinars, seminars, or so forth. Because these chemicals, they are called emerging contaminants, but they are not new chemicals. They are here. They were here for decades now. They were manufactured in 1940s, and since then they have been continuously used in manufacturing industrial processes till this probably a decade back when they were phased out, or some of these phased out. And on this slide, on the left-hand side, you can see that there are the sources. So essentially, PFAS, it's not one chemical; it's a family of chemicals that can range. I mean, some references say more than 4,000 chemicals. Some references even say that they could be as many as more than 7,000-8,000 of these chemicals that we are talking about. So their sources, we use these in our everyday life. You think of your rain gears, your water resistance, stain resistance, and your cookwares, and your carpets, and your upholstery, non-stick. All of these items may contain some traces of these PFAS chemicals. And on the right hand side, this picture shows that how they affect us, their health effects, and down here is, I know you can read it, but it says that what you can do if you are a policymaker, if you are a resident, if you are a health professional, what you should do or what you should look for if you want to reduce the exposure from these PFAS chemicals. There have been a lot of efforts at national and state level, which will be on our next slides. But here, we tried to show you that the tip of this iceberg that you see, it started with PFOA and PFOS probably 10-15 years back when EPA started paying more attention to these two chemicals. But as we learned more about these perfluorinated chemicals, as our understanding grew, as we understood more about health effects, we started going down this pyramid, and in 2013, UCMR 3 sampling that EPA regularly conducts every 5 years, they monitored nation's water supply for 6 PFAS chemicals. And in 2023 to 2025, EPA will be conducting UCMR 5 sampling in nationwide water supplies, and they will be monitoring for 29 PFAS chemicals. So you can understand that it started with 2, and then 6, 29, and that's what EPA is doing. On the research side of things, researchers, they are already analyzing probably more than 100 or hundreds of these chemicals. On the right hand side is some timeline of various actions that have happened in these 5 years. Between 2020 to 2025, some of the major things that have happened, it includes the new health advisories or lifetime health advisories that EPA released pretty recently, just last month. Next slide, please. This is a very basic PFAS and the water cycle, how it gets into the water, other than all those items that carpets and stain resistant or other PFAS containing solid waste. They go to the landfill, and that's how they enter into our environment. But this is a depiction of how it gets into the water cycle. AFFF, essentially firefighting foams, mostly at defense installations, airports, firefighting facilities. They use this AFFF chemical, which is which contains PFAS, and they use it in such a large quantity. So whenever they do this exercise, it goes off the facility and gets into our either soil, or it directly gets into our water, and eventually, even if it goes under through the soil, it percolates, and then it can get into the underground water. Next slide, please. Here is PFAS and solid waste. So whatever we use, it eventually goes to a landfill, and over landfill, if it's not lined, lined means there is some sort of permeable or impermeable layer underneath it. It has the potential to leach into the groundwater, thus contaminating it. So this cycle just tell you some statistics on how many landfills do we have in the nation, and how many could be unlined and things of that nature. So this is also a route of exposure. Today we will be talking about drinking water and PFAS, but there are other routes of PFAS exposure as well that we are currently investigating. I mean, not at drinking water, but EPA and CDC and NIH and other organizations. So PFAS in the national conversations, EPA is probably 2-3 months back, EPA had a health advisory for PFOA and PFOS at 70 parts per trillion nanograms per liter. And these chemicals, they pose health risks, and there were some established studies that says that they are toxic at lower or lesser level than 70 parts per trillion. So many states, they took it upon themselves that, oh, EPA is a bit slow, so let's come up with our own MCLs or reduced health advisories. So this slide shows you some of those states that have lowered down their own health advisories or MCLs. And again, this map is probably a year old, so as we speak, I think there may be another state like Pennsylvania who may have added their MCLs. Back in October 2021, EPA came up with a strategic PFAS roadmap, because PFAS is everywhere. That's why it's called forever chemical. It doesn't get destroyed easily in the environment. So once it is in the environment, it stays in the environment for a long time. So they said that if we deal PFAS in the water, it can come from air route, and then again it can get deposited. So let's make sure that we handle PFAS in a sustainable or in a more holistic way. So what they came up with in this strategic roadmap, that let's look at wherever PFAS is manufactured, how it can get into our environment through soil, water, air, land, and then how can we limit that exposure. Next slide, please. Especially on the water side of things, they came up with various activities, and this PFAS strategic roadmap is available online. If you just Google, you can see various items that EPA proposed that they'll be, the action that they'll be taking along with the expected timeline. So these, if we can, these were the activities that EPA proposed, that they will come up with some new health advisories, new human health toxicity studies, and they have promised these things, and they have delivered some of these. Next one, please. So about a month back, EPA came up with these newer health advisories for lifetime health advisory for these 4 PFAS chemicals. Earlier, there were health advisory for only PFOA and PFOS combined for 70 parts per trillion. And now you can think, or you can see that now they have come up with the 4 such numbers. For PFOA, it is 0.004 nanograms per liter, parts per trillion. For PFAS, it is 0.02 parts per trillion. I can tell you that these are 2 interim lifetime health advisories at this time. I can also tell you that these concentrations at this level cannot be measured with any analytical instrument on Earth at this time. Yeah. We are progressing, right? So on Gen X, earlier there was no health advisory, but there were a lot of concern about Gen X in our drinking water or in our general water. There were many not many spills, but there were a whole lot of information from West Virginia and North Carolina on Gen X. So EPA came up with 10 parts per trillion health advisory for Gen X, and PFBS at 2,000 parts per trillion. The general thing is that if we want to regulate, or if we want to make sure that these are lifetime health advisories, our public water systems, they rely on us. I mean, as residents, we pay them through our water bill, and they employ their treatment processes, right? If we ask them to employ such bigger treatment plants, they're expensive. So EPA said that, okay, along with these things, we'll give you a package. So they said that EPA will be providing grants worth $1 billion to tackle this problem, and that's nationwide, not for just Virginia. Otherwise, we would be rich, right? We would be in here in Lamborghini. Anyway, next one. So the key takeaway that, with these reduction in health advisory levels, what does it actually mean? We at Office of Drinking Water, we regulate public drinking water supplies. Our sister office, Office of Environmental Health Services, they regulate public, not public, but private wells, right? So the key takeaway for public water supplies or our utilities is that if you don't have any detection of PFAS, You need not to do much, but if you're concerned, then please keep on doing monitoring at regular intervals, because that way you would know that if there is any change in status quo. But if you have detected any PFAS in your supplies, EPA says that the utilities need to take some steps to inform our customers that, you know, this is the concentration in your drinking water, and then look at or investigate this further to identify source, so that they can reduce exposure if it's coming from one reservoir, and if that reservoir can be offline, then probably, you know, we can reduce the exposure. So essentially EPA expect such actions from utilities. I would like to mention that lifetime health advisories, they are non-enforceable. They are not standards like MCLs, so they are they are non-enforceable. They are recommendation, if I say so, right? And one contrast with these health advisories in EPA's guidance was that EPA is not recommending use of bottled water. So essentially, if there is a small system that detected PFAS at high concentration, they can't provide, or they didn't want to provide that water. So alternatively, EPA is not recommending use of bottled water, because bottled water is regulated by FDA, and that bottled water may not be as regulated as our public water supplies. And again, we have a VDH ODW PFAS webpage if you want to know more about that, what we are doing, so please visit us over there as well. Next, please. So getting into what we are doing at VDH, Office of Drinking Water, right? So we have legislative bills where we are asked to do certain things to make sure that we are addressing public health concerns. And we are doing some PFAS occurrence study in the Commonwealth's drinking water to make sure that we know how much is, how much PFAS concentration is there in our drinking water, right? If it exceeds health advisory, if it is below health advisory, to just get some information on that. We are very closely working with the Virginia Department of Environmental Quality on this one, because the source water or the rivers and lakes, they are more monitored or regulated by Department of Environmental Quality, DEQ, whereas the treated water is regulated under VDH at Office of Drinking Water. Next, please. So our journey started back in 2020 with these two legislations. House Bill 586, it asked us to look into, this PFAS issue, what other states are doing, if they are regulating these chemicals, how they are regulating, if they are not doing it, why not, and things of that nature. It has many requirements. One of that is form a PFAS work group of stakeholders, and then conduct a PFAS occurrence study and submit report. One thing that we do a lot is we submit reports a lot. On House Bill 1257, it outrightly asked us to come up with MCLs for PFAS chemicals and 1,4-dioxane and chromium 6. And in 2020, we had very negligible data on these chemicals, so we didn't know how much PFAS or how much of these 1,4-dioxane chemicals are there in our water. So next one, please. To implement those laws, we narrowed down to a list of 6 chemicals, PFAS, that we definitely were interested, and we reduced our scope only to source water and drinking water. Next, please. And in that work group, to make sure that it's not just there are just regulators on that work group. So we had representative from small, medium, large water works. We had representatives from chemical manufacturers who actually manufacture these chemicals. We had general public representatives, subject matter experts, and physicians, and state health toxicologists and DEQ. So essentially, to get a holistic approach on how to deal with these chemicals, we formed this work group. Next one, please. This is a composition of our first PFAS work group. So essentially, there are many organizations that are involved. Next, please. So we conducted a phase 1 PFAS sampling study. PFAS is an expensive chemical to analyze, so we at that time we didn't have much funds, and House Bill 586 asked us to analyze no more than 50 water systems. So essentially we were able to collect samples from 63 locations from 45 water systems in the Commonwealth. To give you a perspective, we have more than 2,800 systems in Virginia, right? And in this selection of this 45 systems, we wanted to make sure that we capture larger water systems, 17 large water systems in Commonwealth that serve more than 4.5 million Virginians. We want to make sure that what they are drinking. We also wanted to measure, we wanted to see that surface water systems or groundwater systems that are close to these airports, unlined landfills, or other such industry DOD installations, if there is any potential of migrating these PFAS chemical to those facilities. So that's how we selected those sites. Next, please. And here is the geographic distribution from where we collected in that very small 63 sample study. So you can see, like, we tried our best to collect samples from all geographic locations. It shouldn't be that we collected everything from Richmond or Northern Virginia. Next, please. So here are the results that we got. We conducted this study in summer last year, 2021. We used EPA method 533, and again we took samples from source water as well as finished water. And all this information, all these results and reports are available on our PFAS webpage because it's public information. Next, please. These are the results that we got. I think in the interest of time, I'll go to the next slide. So essentially, we got 15 detections out of those 63 sampling locations. And at that time, the health advisory was 70 parts per trillion, 70. And none of those locations, they exceeded these numbers for PFOA and PFOS. There was one location that detected HFPO, which is also known as Gen-X. Sometimes it's used interchangeably, at 54 parts per trillion. Neither DEQ nor us, we didn't investigate the source of those things because that would have taken us in a whole different direction at that time. And then there is, next one please. So essentially this House Bill 1257 asked us to, go one step beyond that set up MCLs. We know enough now, and let's go to the next step. And it asked us that we need to start the regulatory process in January of this year, 2022. So we followed the directions based on whatever limited understanding we had. We initiated the regulatory process in January of this year. In February, we published Notice of Intended Regulatory Action, NOIRA, where we asked public to comment on these regulations, and that ended in March of this year. So next please. We received just 3 comments on this topic, and the next task in this regulatory process is to form a regulatory RAB, activity panel or advisory panel. So essentially it's another work group. So that was in March next year. So that was in March, and in April we received another bill, House Bill 919, that asked us that, okay, VDH can continue working on their legislative regulatory process, but again, that regulatory actions will not be effective until and unless we follow the other requirements mentioned in this new bill, which was essentially follow EPA's Safe Drinking Water Act for regulation, which is very time intensive, time consuming and resource intensive, and then again form a work group, conduct another study, and then make recommendation and submit reports. Next please. So in March we were over with public comments, and in April another bill, so that said that form another work group. So then we said, like, we need to form 2 bills, and the second bill asked us to form that work group in July. So we said, like, now it's April, May, so shall we wait or shall we form two work groups? So, and then we have very limited resources, and we were also working on PFAS occurrence study. So we thought, let's hold off for 2 months, work on this PFAS occurrence study, and in July, August, we'll form one PFAS work group to avoid any confusion. And the first work group, we met regularly, and all those meetings, they are also mentioned on our PFAS webpage. They recommended that maybe we need more expertise or subject matter expert on health toxicology, because these are new chemicals, right? So, and that also asked us to have more expertise on treatment technologies or water economics, that, okay, you can come up with any number, but we need to make sure that water utilities can reasonably achieve that. We don't want to create a treatment technology of $1 billion to a small community system. So we are proposing a new work group. We call it Work Group 2.0 with different memberships, representatives. So we have many subject matter experts on toxicology, treatment, water economics, and things of that nature. Next, please. And the other thing that we are doing simultaneously is on the final column is phase 2 PFAS occurrence study. It's going on as we speak. The first PFAS study collected sample from 45 systems. In this investigation, we are collecting samples from 400 systems. So it's a much larger study. And we are only taking samples from entry point to the distribution. So essentially after treatment, when it goes to the distribution line, that's what we are interested in, not the source water side. But we are working with DEQ, and they are looking at the source water side. So it's in progress. We hope to complete this study by end of September this year. Next, please. For this investigation, because it's 400 samples, so we are partnering up with CERCAP. They are collecting samples for us for this study. We'll use the same analytical method that we used in our phase 1 study to make things comparable. We'll apply appropriate QA/QC so that we don't create a false alarm. And then we are telling that our waterworks will have access to this data before the widespread public release, so that they can be prepared for any communication. Next, please. Here is a quick timeline on various activities beginning September 2020 to August 2022. So essentially in 2 years, we think that we have come a long way in our understanding, expanding our understanding of these chemicals. But still, there's a lot to do, as Dr. Cohen and Dr. Carey said. There's a lot to do in the field of environment all the time. Next slide, please. Next. So essentially, any such thing, it's relatively easy to implement or to come up with a regulation. But again, looking at the implementation of that regulation is more difficult, because eventually our public drinking water supplies, they need to come up with the treatment technology or capital investments and things of that nature. So this bipartisan infrastructure law, they have specified about $10 billion worth of funding at a nationwide level just to deal with emerging contaminants. Earlier, number of 50 billion was mentioned, that is for water infrastructure, but this 10 billion is just for emerging contaminants in the nation. And out of this, a large pot of money is to help our small and disadvantaged communities, systems in those communities. And in Virginia, under this BIL Emerging Contaminants Funds, we will be receiving about close to 12-13 millions every year for next 5 years. But in a separate funding of that 1 billion that came with the health advisories, we are expecting, that's not a real number, don't quote me on that, and remove this from the recording please, that we may receive probably close to $100 million per year for next few years to tackle this problem. But that is still not confirmed. So essentially, if you have any questions about the treatment, regulatory process, if you want to get involved, or if you are not sure where to go, feel free to ask or reach out to us. Next, please. With that, thank you so much for listening in, and I'll be happy to answer any question if there is time. Thank you, Rob.
Say we have time for one quick one.
Oh, okay.
You can catch me later outside.
Someone behind me have a more important question.
You can catch me later.
It's okay.
Go ahead.
All right.
I hope.
So I was wondering if, because there are so many different specific chemicals under the umbrella of PFAS, if there's any way to do any kind of like extended producer responsibility for specific chemicals, if 3M produces 1,000 of those chemicals, and 3M's the only person because they've patented those 1,000 chemicals. Is there any thought to doing that kind of investigation yet, or you had mentioned that there was no source investigations yet? What are the plans there?
We didn't conduct any such source investigation because of lack of resources and time. But again, whenever any chemical gets introduced into manufacturing, they are required to report it to EPA and certain databases, so they are tracked. But again, at this time, there are so many of these chemicals. Out of these thousands of chemicals, I would say we don't have even a standard for probably more than half of these chemicals. So there's a lot to learn. EPA, CDC, NIH, they are working with these manufacturers, 3Ms, DuPonts, and Chemours and all. But because of the complex regulatory process, it's hard to get information sometimes.